Hi YouTubers, my name's Paul and this is a short video in relation to a total hip replacement that I had on the 30th of November. Today it's the 19th of December, so it's 19 days post operation, and really just wanted to add to the pool of information that's currently out there on YouTube. And obviously it's going to be of something of interest to somebody that's potentially waiting for a hip replacement. Mine was a left hip replacement, and I believe it was a metal ball on a polyurethane socket. So in relation to the anaesthesia, I opted for a spinal injection with sedation, and to be honest with you, that's something I would highly recommend. At first I was a little bit unsure about having a needle injected into the spine, but to be honest with you, I did not feel a thing. Just literally sat up on the end of a bed, leaned forward. I think she injected a local anaesthetic, and then obviously she injected the epidural, and I just didn't feel a thing. What you do feel a few minutes later is you start to feel like a burning sensation in your feet, which is perfectly normal, and you start to get pins and needles, and then you start to get this numbness that travels all the way up to about your navel region. Quite an unusual sensation. You can't move your legs, you can't move your lower limbs, and you can't feel anything. So yeah, it's quite strange. Before you go totally numb, obviously they try and get you onto the plinth or the table in your operated position. Once I was in that position, they then gave me the sedation, which I thought was just going to make me drowsy and I was going to be awake during the procedure. But to be honest with you, from her saying that she was just about to give me the sedation, you know, within a matter of seconds I was completely out, until they woke me up after the surgery. So I didn't know anything about it at all. And the good thing about having the spinal injection with the sedation is, because you're not having a general anaesthetic, you don't need as much pain medication, because you are numb for I was numb for probably about 3 or 4 hours, no, maybe less, 3 hours post surgery. So while I was actually brought up and put into the the ward, I couldn't actually feel anything. I was actually quite numb, and then eventually the sensation starts to come back. Once that sensation comes back, obviously you're on medication. In this case, I think I was on long-acting and short-acting morphine. That said, the morphine didn't agree with me, and I was in hospital for 4 days. And during that period I didn't eat a thing. Well, I actually had 1 bowl of soup within 4 days. The rest of the time I was just drinking water. I just had nausea all the time, and I think it was on the 4th day I started to get diarrhea, and they put me into a ward on my own, or into a room on my own. Yeah, so you know, that wasn't particularly enjoyable, but they did put it down to the morphine. Yeah, so the usual procedure is to get you out of bed as soon as they can, get you moving, and that wasn't too bad, to be honest with you. You know, once you get a little bit of confidence in putting a little bit of pressure onto the hip, you're pretty much, you know, quite happy to get out of bed and what have you and start moving around. So once I was discharged, I would say probably about 6 days post-op, once I got home, a couple of days after getting home, the incision site, the knee and the ankle swelled up quite considerably, to be honest with you, quite significant swelling and bruising, and that certainly hindered mobility. It was quite painful. I found it difficult to sit for long periods of time, so you were constantly sitting, lying, moving around as best as you could, but that certainly had effect on the mobility. The most painful things I would say were probably getting in and out of bed. That was really painful. Getting in and out of the car, that was really painful. From my point of view, you were given obviously exercises to do, and one of the most painful exercises was a straight leg raise when you lay flat on your back, and I couldn't do a straight leg raise, and I still struggle now, and I'm at post 19 days post surgery, and I struggle with a straight leg raise. I can do a straight leg while I'm sat down, but I can't do it while I'm laid down. The rest of the exercises aren't too bad, you know, and so on. So yeah, so hip flexion is a problem as well, or was a problem. It is actually getting better. So for me, it tended to be the leg raise, straight leg raise, and hip flexion that seemed to be problematic. The other issue, and something to think about, is, and they don't emphasise this enough, is it is difficult to sleep at night, and I'm currently getting probably 4 to 5 hours sleep, and I wouldn't say it was good sleep. So generally, I'm probably staying up till about 1 in the morning, you know, then I nod off, then I wake up about 3 o'clock, and I wake up with what I can sort of perceive as nocturnal leg pain. So you get a dull ache in your hip, and you're just constantly fidgeting and trying to move the hip into a different position to alleviate the ache. And then, you know, I probably awake for another hour, then I might get another couple hours of sleep. So for me, 4 to 5 hours is a good evening, a good night's sleep. But it certainly isn't, you know, ideal, and you are pretty much, I don't know, fatigued during the day. Yeah, the other thing is, it's not just about nocturnal night pain, it's about sleeping position, because you have to sleep on your back, and I find that quite difficult. And to be honest with you, I've got an electric bed which is fully adjustable, and that's one thing that I find does help, is where you're able to raise your legs, which I'm able to do with this bed. But even though, you know, I can get myself into a comfortable position, I just don't like sleeping on my back, and I find that difficult, so that doesn't help. So yeah, what about, say, 12 days post-op? The swelling started to reduce, my mobility became much better, and I would say I could sort of place about 80% of my body weight onto my operated leg. 17 days post-op, I was getting a little bit too confident, and I was doing probably too much exercise, and the following evening and the following day my hip was aching a lot more, and I found it difficult to put weight onto the leg, and I sort of regressed by a few days, to be honest with you, and I couldn't do the exercises that day. 19 days post-op, so this is pretty much today. This is where I am today. I do feel much better. I'm able to walk without the crutches, but with a limp, and I'll get back to that in a minute. The limp is an issue. Physio actually came out on day 18. It depends on where you are, you know, geographically in the country, and which hospital you're under. Obviously, the hospital that I'm under provide a physio service that comes out for approximately 6 weeks, so they come to your house and obviously assess your progress and help you with your exercises. And at that point, and it's something I knew already anyway, I was just hoping that it wasn't, but unfortunately, and it is a risk and it can happen, I have actually got a leg length discrepancy. So the hip that was operated on is about an inch longer than the unoperated side. So when I am walking without the crutch, I am actually walking with a limp, which really you want to avoid, because you want to try and get that normal walking pattern back again. So unfortunately, the physios had to refer me to the orthotics department to try and correct the leg length discrepancy, which I'm hoping they can do with an insole, as opposed to, you know, having to have your shoes altered and what have you, which is probably going to be quite expensive. So yeah, that's pretty much where I'm at the moment. I've actually ordered an heel raise from eBay. I think it's 10 millimeters, which is probably about the max you can put into your shoe. So I'm going to get the heel raise anyway and just see how that sort of goes. I'm not sure exactly how long it's going to be before I go to see somebody within the orthotics department. I'm not 100% sure. So yes, so that's my progress from surgery to now, which is day 19. So it's you know, it's challenging. Each day you do make progress, unless of course you do what I do and you do a little bit too much and it might regress you slightly. So, but yeah, stay positive, and hopefully things will become good in the end. I hope you find this video of interest. Many thanks. Bye bye.